Hi, I'm Ann Alton. I am one of the staff physical therapists here at Kirk Center for Healthy Living. And I wanted to come to you today to talk to you a little bit about Ehlers-Danlos Syndrome. Yes, it still is hard for me to pronounce it. But Ehlers-Danlos Syndrome, it affects a lot of people and a lot of people who have chronic pain. So I see a lot of people who come through here who I think probably have it based on their symptoms. So I wanted to talk to you a little bit about it so you might be able to recognize it and maybe question if you have that issue, okay? So the first question is like, what is it, okay? The basics is that there are at least 14 identified types, okay? This has to do with our connective tissues. And these 14 different identified types are, only one of them has not been genetically identified. The rest of them have been. I suspect there are more types that have not been identified yet. But connective tissue is something that we used to think of as packing material, something that was like taking up space between the important things like muscles and organs and things like that. Okay, but we have recently learned that it actually can be considered an organ because it has immune cells, it has nerve cells, blood cells, lymph cells, fat cells for nutrition, all kinds of different things. And it serves a bunch of different purposes, from stabilization to helping know where you are in space. A lot of different things. Not too many to list here, but we call it fascia a lot of times, and depending on where in the body it is, it may be called peritoneum or pleura, which is up here. And that's because when we first did dissections, we really did not know that we were looking at the same thing. So, so it depends a little bit on that, but it's more than that. It's also the scaffolding for your muscles, your organs, your vessels, your nerves, all of that. Okay, so it serves as the scaffolding for all of that. So really this connective tissue runs throughout your entire body. It is the glue, it is that holds us together, and it communicates between different parts of our body, okay? So this scaffolding is made up of primarily 3 types of fibers, okay? The main one that we're looking at here is called collagen, which you probably have heard of because they use it in, plumping up your lips and things like that. But Ehlers-Danlos has to do with, and the 14 different types have to do with either how we make collagen, how we fold collagen, because it's a protein, and all proteins need to be folded in a certain way in order to be effective, or how that protein attaches to the tissues around it, okay? And so these different types have to do with which part of that whole system is broken down. The main symptom of Ehlers-Danlos is flexibility, okay? So we look at somebody who is that kid that does like the party tricks, or they put their both feet behind their head, or they stick their entire fist in their mouth, or they touch their tongue to the tip of their nose. Weird stuff like that, the party tricks that not everybody can do, that requires a lot of flexibility. This is a little bit different than like Marfan's, which is like way on the other end of the spectrum, okay? But keep in mind, this is a spectrum of flexibility. Basically, collagen, if it's not working right, it leaves a higher collagen to, or elastin to collagen ratio, elastin being one of the other proteins that makes up the connective tissue. So as you can guess by the name, elastin is elastic. And so if you have joint capsules that are made primarily out of elastin and not a nice mix of collagen and elastin, you can have loosey-goosey joints, okay? So we have some scales, a scale that checks for this kind of elasticity. It only checks a few joints, and so if like you don't meet the criteria, but you're really flexible in other joints, it doesn't mean that you don't have EDS. It just means you don't fit this particular criteria. They're working on it, okay? So what are these? One of them is to be able to take your thumb and to touch it all the way to your forearm, okay? That's one of them. One of them is to be able to take your pinky and at least get a 90-degree angle, okay? And this is both. So if you can do it on both sides, you get 1 point for each side, okay? Same with the pinky. Another one is the arm. See how my arm is like more than 10 degrees hyperextended? Okay, that is a sign that that joint is hypermobile. So you get 1 for each arm. The same thing goes true for the knees. Okay, that's another one. That one's only 5 degrees. Okay, so hyperextending the knees over 5 degrees is considered a positive test for that. The other one is to be able to, and I don't know if you can see this from this angle, but the other one is to take your palms and without bending your knees, touch the floor. Okay, and that's the last one. So it's a scale out of 9. 5 of those out of 9 is considered hypermobile. Okay, that doesn't mean you have Ehlers-Danlos. It just means you're hypermobile. Okay, and again, like I say, you can have like a 4 or a 3 and your shoulders be able to do all kinds of funky, weird things, because we don't test the shoulders in this. But like I said, they're working on that. Okay. Some other examples of things that you might see if you have Ehlers-Danlos is there's a test, and I can't remember the name of it, but you take your thumb and your forefinger and you wrap it around your wrist, and if you can overlap your thumb over your pinky, that's considered positive, okay? If you make a fist with your thumb inside and your thumb sticks out the other side, that's also considered a positive test, okay? I think this is a like group B of the criteria, and I think you need a few of them to do this, to qualify for that particular group. There's also a weird thing called Piezogenic Papules, and this has to do with your heels. And so it needs to be on both feet for this to qualify. But you may have noticed it if you have them, this really weird kind of, so I have this visual here, this really weird kind of popping out, and it's obviously not green, it's white on your skin or a lighter color than your skin color, right here, and they just kind of pop out. Okay, it's not in any particular like, it's not this regular. They can be all, distributed in weird places, okay? But basically that's what that looks like, is that Piezogenic papule is one of these little bumps, okay? So if you have those and you're like, what are those things? That's an example of something that somebody with EDS would have, okay? The other things, if you have like super stretchy skin, so mine's not too stretchy, but like if you can pull up and it's like pretty stretchy. The other one is like super soft, silky skin. If somebody has ever said to you, oh my gosh, your skin is so soft, that's another another sign that you might have Ehlers-Danlos. The other main indicator that you might have this is if you have like really multiple system problems. So you have gut problems, you have teeth problems, you have joint problems, you have all over body pain, you have you have heart issues, like, or if you have like racing heart when you stand up, or you pass out, those kinds of things, like, then nobody can figure out, like, you're going to see all these different doctors for all of these different things. The key phrase for Ehlers-Danlos Society is, if you can't connect the issues, think connective tissues, because that's the one thing that they all have in common. And how are we doing on time?
11 minutes.
Okay, stop.